Good morning, colleagues, and welcome to this morning's County Cabinet meeting. Firstly, apologies and declarations of interest. I think everyone's present, so there's no apologies. Any declarations of interest to note? Mark.
Good morning, Simon. Under item 5, as Deputy Police and Crime Commissioner for West Mercia, I declare an interest in some of those aspects.
Steve?
Yes, thank you. Under the same item, declaration of interest in relation to contracted work to the Office of the PCC as well.
Okay, yep, those are two logical declarations. Any other ones? I don't see any other ones. So, shall we move on to the confirmation of the... Oh, public participation first. None recorded. Confirmation of the minutes, and they're from the 24th of October, colleagues. Are you happy to note there's a true and accurate reflection? Allow me to sign them now rather than dither and delay for another day. There we are. Okay. So we've got two special guests as well today who will be talking about their both respective independent reports, and we'll introduce them shortly. But we'll move on firstly to the first item, which is the Adult Safeguarding Board Annual Report. This is the first of two annual reports we're taking together on very important topics, as I know all colleagues will know, in terms of children's safeguarding and adult social care as well. And I'm glad to see them together, actually, because it helps blend the conversation about some of the responses we have in terms of some of the most vulnerable people in society. And I'd ask Richard maybe just to start, and then we'll bring in and welcome Keith as well. It's good to see you today, Keith.
Pleasure.
Richard.
Thank you, Leader, and good morning, Cabinet. I'm very pleased to introduce the Worcestershire Safeguarding Annual Report to 23-24. I'd like to welcome Professor Keith Brown, who has supported our council fantastically over the years. And I know he's been on holiday in Worcestershire this week as well. He's 3 days. So it was good to see you at Health and Wellbeing Board earlier in the week as well, and the awards yesterday. The report outlines activity that's guided by the 2014 Care Act. It's important that we have assurances that our safeguarding arrangements are effective, and with partners we carry out an effective service. There's a couple of key areas, many more, but a couple of key areas that give some indication of service levels. So the Safeguarding Adult Review referrals, the SARs, for 23-24, we had 13 referrals, and the Complex Adult Risk Management, the CARMS project lead, was appointed in October 22. This sets out a clear approach for multi-agency meetings when working with people with complex needs who are at risk of abuse and neglect but don't need social care or safeguarding criteria. And it was established in response to recommendations from Safeguarding Adult Reviews. In October 22, a project lead was employed 1 day a week, and that was increased to 2 days a week in August 23. Now, with the CARMS, in that time period, we had 81 referrals. 52 were appropriate to progress to a CARM meeting, so a multi-agency meeting. And that was determined to be a 113% increase in referrals and a 225% increase in referrals that progressed to a CARM situation. Evidence that awareness amongst practitioners about CARM has increased, with more appropriate referrals being made since the launch of CARM. Now, the issue there with CARM is that funding for that role is due to run out at the end of the year. Now, the role is funded as a partnership presently between the county, the ICB and the police, and it's important that looking to secure that position, we look across partners in order to continue. But we need to look to continue it. Our safeguarding operations helps give us the opportunity for reflection and improvement. At the Health and Wellbeing Board this week, a question was asked why we don't celebrate good news. We know we live in difficult times with rising demand, budget constraints, and often forget the great work undertaken. And whilst it doesn't always seem so, there's more good news than there is bad news, but yeah, in many respects. The question was timely, as yesterday was the very first Safeguarding Awards, and I thank Keith and the team for an excellent event and bringing those awards to announcing those awards. We handed out many awards. The stories were inspirational, and even included a Tesco delivery driver, because they go into houses regularly and can see situations. And this particular Tesco delivery driver called on somebody who was needing support and needing help, and he was able to sit with that individual and then signpost to get to a solution. So without those awards, would that person have been recognised? It's so important. But the awards went to people like St Richard's Hospice, to Worcestershire Association of Carers, indeed our own staff who do a superb job, and that's why they're really welcome and really important. And I'm sure Keith will talk a little more about them. I hope our comms team, our communications team, really take on board the terrific stories of that day, because it's important that we put the good news out there as to what safeguarding does and adult social care does. We work collectively with our partners, and that is a force of good within this region. And so I welcome the report and happy to pass over to Professor Keith Brown.
Thank you, Richard. Keith,
Thank
you have
you.
the floor.
Thank you very much. It was a great day yesterday, and I want to pay tribute to you as a councillor and your staff. Two of the social work team leaders were nominated by their teams because they were so inspirational as managers. And I just think it reflects so well of the culture here that, you know, staff actually recognise quality leadership from their own people and nominated their own managers for awards. And it was a really great day. My panic when we set this up was that there'd be nobody nominated and nobody would turn up. But the room was pretty full, and there was a range of things, and we hoped to do it together. And as Councillor Morris has said, it was just wonderful to celebrate with people and to recognise the stories and the difference through those stories that individuals' lives have been impacted with. And it really was quite heartening. So we'll do it again, and hopefully next time we'll get even more media attention. I'm on BBC Radio Hereford and Worcestershire quite a lot with regards to scamming. I'd quite like to be on it with regards to adult safeguarding for you, because I think that's a story that's just not told enough. I also, before I go into any more detail, I want to thank you as a council, in particular the Chief Exec and the Director, for the additional resources that have been put into dealing with the backlog of safeguarding inquiries. You put additional resources into that, and now I'm pleased to report that your safeguarding inquiries waiting list is almost down to zero. And I wrote to Mark just the other week to sort of say, would he please pass on the board's thanks to the staff and the team that did that. When you've got a big waiting list, it's quite something to get through that and to dedicate and to work hard to clear an ever-increasing waiting list. I won't go into the SAR referrals as such. You can ask me questions if you want any specific information about those. I have almost a declaration of interest, actually. The CALM coordinator is an ex-student of mine, which kind of makes me super proud that I once did something correct as a professor, that I've actually got students now knocking around the country, still delivering work. And I do want to talk about the CALM process. The most complex and difficult people in our communities are often, by definition, people with complex needs. They are on the margins of society, whether it be because of alcohol, whether it be because of drugs, whether it be because they're homeless, or a combination of all those and others. And they're often very difficult to engage with because they don't turn up to appointments. Their lives are erratic. Their lives are very complex. And what the CALM process, and in particular the CALM coordinator, has been able to do is bring together agencies, different agencies, to focus on and come up with creative solutions for these people. And so meetings have been held in cafes, in local clubs, in different places to standard offices. And we've been able to engage with these people. And what's really fascinating on the impact data is the largest reason why people have come out of the CALM system is because they've moved on to engage with services appropriately and are no longer needing that wraparound support. And I'm convinced that that investment in somebody 2 days a week has not only saved the council a lot of money, it's saved the health economy a lot of money. It saved us as a board potentially from having to do SARS in the future when something terrible has happened. But more importantly, it's made a significant difference to some of the most marginalised people in your community. As Councillor Morris mentioned, we were able to set the process up 2 years ago because we had dare I say it, we had a slight underspend as a board, and we were able to utilise that underspend to get the process going. Last year, we gained some one-year support to fund it for another year, and that funding runs out in March. And as Councillor Morris has suggested, we're hoping that you will find somehow, in what I accept to be very difficult times, the money to fund this 2-day-a-week post, simply to enable us to coordinate effectively across those areas. I feel like a little bit of a broken record as my last point. The thing that keeps coming to the fore time and time again with regards to SARS are issues around mental capacity, in particular around what we now refer to as executive function. For far too long, we've looked at people and we've said, do they have capacity or do they not have capacity? And the issue is that in the middle, there's a lot of people that have capacity to do some things and don't have capacity for others. And the story I gave just a couple of days ago, and I'll give it again, as a few years ago before my mother passed away, if you'd have met her, you'd have been certain that she had cognition and capacity. She was very eloquent. She was able to communicate with you. But if she took a packet of ham out the fridge, she'd be able to read the sell-by date, and she could tell you what that was, but she did not have a clue what it meant. Her cognitive ability had got to a point where she could still read, she could still communicate, but she couldn't cognitively process, and that's what we mean by executive function. Are you able to make sense of the information and utilise the information? So if she'd have eaten the ham and got ill, somebody could have said she's self-neglecting. My mother would not have been self-neglecting at that point. Her executive function was a situation she couldn't manage at that point. And of course, this becomes really very nuanced and subtle when it comes to things like consent to treatment and these sorts of things. Indeed, I would sometimes ask us all, do we ever fully make an informed consent to treatment at that moment of duress and pressure, or do we just say, please get on with it and make me better? There's a whole load of issues there. We were very pleased to use some funding last year to produce an animated podcast on executive function, hosted by and run by Worcestershire. It's now used as a national training tool across the country in this area. I think a few of you have seen it. If you want to see it, it's on our website, or we can get it to you. And it's basically a story of my looking after my mother and the issues around executive function. I'll pause and happily take questions, so thank you.
Thank you, Keith, and thanks for bringing it to life, because those kind of examples that people can relate to in their daily lives or through their families, there will be a lot of people listening and watching that can relate to those kind of situations, and I think it brings the work of the board, but also that fine balance that we're having to operate in to life in a really meaningful way.
Thank you.
And I'd want to put on record our thanks as an authority to your work and the work of the board as well, and the wider partnership, because it is really, really meaningful and it's very much valued by the County Council. I know our partners as well when I speak to them. Richard, I think you moved the response. David, do you want to second the response? And then I just want to open it up as well to any questions and points and thoughts.
Yeah, very happy to second, Simon. Yeah, thank you.
And are there any points for Keith in terms of things? I was looking at Karen because I know some of the challenges that you've had and you go through.
Yes, thank you very much indeed, and thank you as always, Professor Brown, because I always look forward to this cabinet meeting because we have an update from Steve on your left, and we have your update, and these are about real life. These are bringing to life real issues that face our population of Worcestershire on a daily basis. Adult social care safeguarding is, to me, and the way you explain it, it clarifies the position. And my first thought was, what happens in the actual health service around educating health professionals in this area? Because that cognitive approach is really, really important, and I'm not sure that they always take the approach that the county council take. What are your thoughts, please?
I have lots. It's a public meeting, this, isn't it? And I'm slightly nervous of what to say. I could go into professorial lecture at this point. Suffice it to say, I'm actually on a bit of a national campaign on this, to the point where I'm challenging some of the universities that are healthcare professional training and asking, can you demonstrate to me that A, you teach this area, and B, you assess it? Because the SARC across the country, 50% or so come back to there's an issue of a lack of understanding of the Mental Capacity Act. Now, as someone who's authored most of the national guidance in this area, it's kind of like, why haven't you read it? So it's a little bit poacher turned gamekeeper sometimes in these things, but I think you're absolutely right. We are still years behind often helping people catch up with these subtle nuances. So for example, another little silly one, I suspect if any of us have been to hospital recently or had a relative, you go in and you get clerked in and they ask you, who are you, where do you live? And then they ask you, who is your next of kin? Well, given that's a meaningless concept in law, and the Mental Capacity Act makes that very clear, the term next of kin is meaningless. You have no rights over your husband, your child, your parents in law without a lasting power of attorney. Why are we still doing that? Yeah, the question really probably should be, who should we contact if you die in this institution? And so we've still got really very fundamental things to change. And I do think that in local authorities, in the world of social work, we're quite a lot further down that line of understanding the nuances of the Mental Capacity Act and the Mental Health Act than health. Not in all cases, clearly. There's some really excellent practitioners there in health. But the NHS is a large body, and there's a lot of work to be done there. And understanding the subtleties in these areas are really quite important.
Yes, it's a conversation in itself, the area that you're opening up.
Mm.
I wonder whether I can bring in Marcus, and maybe Mark, because in terms of your professional experience from different walks of life, obviously from the police and also from some of the work that you do, Marcus.
Yeah, I suppose a comment, and then I'll try and frame it into a question. It's, I suppose, it's a bit like a busman's holiday sitting here for me as a solicitor who predominantly specialises in mental health law, representing detained patients under the Mental Health Act, and in particularly a lot of restricted patients. And the issue of capacity really rings true. And also, of course, not only do people have often capacity in respect of different things, capacity fluctuates, which it adds as a real dimension, particularly when they're assessed for capacity. At one point in time they have it, and then when they're assessed a couple of months later they don't have it, and then it reverts again. I guess from my perspective as a practicing solicitor who sees both social care and indeed health and how they work together, or in fact how they quite often don't seem to work together. What view do you have on joining the dots between adult social care and health, so that ultimately it's the patient centre who is at the centre of the decisions that we take?
A lovely question. I'm very happy to answer, but can I caveat it saying this is me answering it as the Professor of Social Work and the ex-director of the National Centre, not as your chair of the board. If we were creating services today for these people, I don't think we would start off with two distinct groups of social care and healthcare, would we? We wouldn't create a system like this. We would start off in a very different place, and we'd build services designed to support people. And so folks like yourself and others are constantly having to bridge that gap. And so I think the more that we can do in the future to help bridge that gap, the better. And I just hypothecate and suggest that in years to come, if we ever have a Royal Commission or something as to how we should run healthcare, social care in this country, we are likely to see an ever-increasing convergence of those things. But clearly we're still dependent on somebody in government being brave enough to step up and say, we really want to look at this and tackle this issue. And we're going to have to do it because you're not the only council in the country that's really struggling under huge pressures in these arenas, which have knock-on impacts in the whole system. And yeah, I just think we're just going to have to deal with that at some point.
Yeah, I absolutely agree with that. Mark?
Thank you very much. I'd like to ask about the effectiveness of the joint working with the wider agencies in Worcestershire around these issues. So, as I announced at the start, I'm the Deputy Police and Crime Commissioner, so governance of the police as well. Just wonder how well that interface works with wider agencies like the police, like the fire service, others. You mentioned about the delivery drivers who deliver goods so often now to into people's homes, particularly the elderly who might have once gone out shopping and now through COVID got used to online and all those sorts of things. I just wondered if there were any other points or thoughts on how effective the partnership working is and how those could be improved still further.
What I think I bring to this role as chair of your safeguarding board is I chair 2 other safeguarding boards in the country, and for a number of years through COVID I chair the NHS National Safeguarding Network. So I see the situations from lots of different perspectives right across the country. And I would want to say and state on record here, this is one of my favourite places to work for these reasons. You have a fairly stable senior management team. There are parts of the country where they're just struggling to even find a director or an assistant director. And in that stability of your leadership team, I think that provides a greater stability to cross-working between different organisations. If you haven't got the leadership stable, it tends to fall apart. And generally speaking, what I see here is real evidence of really good working. I see superintendents of the police force committed to working at the board, to being at the board. I see health people regularly at the board. I think one of the really fascinating things, look at one of the SAR reports and just look at the membership of that SAR team, where they've come from and the seniority of those people and the commitment from those organisations. And it's amazing. People are genuinely committed in this patch of the country to working together. And to me, it stems from good leadership at the top and then having, staff and good staff. You as a cabinet have got budget pressures. Other cabinets like yours, and indeed some of the other boards that I'm on, their issues are, can they even find staff to fill the vacancies in some parts of the country? So be grateful for the good things that you have when the days are tough, when you've got to make the tough decisions. So I hope that answers the question. I genuinely think that we're doing well here. Clearly it can always be improved. To pretend that we can't is folly. But we do have commitment across the board here, from health, from you folks, from the police, from fire. And also we had, again yesterday, we had the voluntary sector. We had advocacy groups. We had lots of people committed to doing work. We had the tissue viability team, who are some of the national leaders in tissue viability. And you think, oh, blimey, what's all that about? Well, if you've got a wound or you've got a pressure sore in a loved one, having a really good tissue viability team in your patch is really rather helpful.
I think, again, because I can't remember who said, I really enjoy these sessions in terms of Cabinet when we look at these, because it isn't the day-to-day grind. You can lift your eyes up to look at what's going on. And I think Professor Brown's comments about Worcestershire and the partnership working is sometimes, because we only live and work in this place, we take it for granted. But it isn't going on everywhere. And I think it gives us an opportunity to really note that success. And whilst always looking to strive to do better, we also need to recognise just how much good work is going on. And I think we can absolutely echo those comments. I've got a range of other speakers, and I'll bring in David Ross, and I want to bring in some of our professionals as well to contribute to the debate.
Thanks, Simon. Yeah, thank you. And thank you, Professor Brown, for attending today. And thank you for the personal example around executive function, which I hadn't really considered, but it really brings it home to me how one can make judgments about people and that are incorrect. And I do think this is not perhaps widely known as it should be. I also wanted to just say to Cabinet, to remind Cabinet, of course, that it was at a previous discussion with Professor Brown which inspired the design of Healthy Worcestershire, which I know our Director of Public Health will be talking about shortly, and its inclusion for the support of social isolation and scam. And I know you mentioned on about scams. Well, of course, both of those, form part of Healthy Worcestershire and are both integral to, a healthy and well-being life for our people. But I won't discuss them too much because I know that Lisa wants to step in and give you the more professional opinion of it. But I just wanted to say thank you very much, Professor Brown. Thank you.
And I'm personally thrilled on that area. You will have heard in the news last month that banks have been committed now to refunding up to £85,000 and are also able now to delay transactions by up to 4 days to investigate potential fraud. I started that campaign 11 and a half years ago with 2 all-party parliamentary reports, and it's taken me over a decade to see that through. And now I really feel like, well, maybe retirement can occur because I've achieved that. And it really was over a decade to achieve that. So I'm delighted.
I'll bring in Mark Fitton first.
Thank you, Leader. Just a few comments, really, in terms of thanking Keith and the board for the annual report, looking back to the previous financial year. Just a reminder, in a sense, that the board is an independent board, whilst under the Care Act we're required to ensure that we have those processes and boards in place. It is an independent chair. Keith is an independent chair and represents the partnership as much as just the council in that sense. I think often the board gets to hear about when things go wrong, whether that's ending up in a coroner's court case with potentially Regulation 28s that are issued on the authorities that are found at fault. But what was really, and Keith was instrumental in this, we had the awards yesterday, probably delivered on a shoestring, I think, in terms of the arrangements for those awards. But it was really good to see actually the good work that we do in Worcestershire across those teams, across whether that's the NHS social care or otherwise. And the real good, we've mentioned it a couple of times, but that real good example that safeguarding is everybody's business. And that's the message that we need to give. It isn't just for the local authority, the NHS, it's everybody's business. And the Tesco driver that discovered that individual that was incredibly distressed, literally throwing the food out, I think, of the property at the time and not accepting delivery of that food, but getting to a stage there where we could stabilise that position, with Tesco actually following up a safe and well check 2 or 3 days after that had occurred. So that was great to hear those sorts of things at the awards yesterday and celebrate what's good, as obviously sometimes making sure that when things go wrong, we get them put right for our future work, really. So those were my comments, I think, in that sense. And I'd also like to say a big thank you to the lead member, Councillor Morris, in relation to his involvement at those awards yesterday and giving it that sort of sense of importance in terms of celebrating the work that we do. Thank you, Leader.
Thank you, Mark. And certainly in terms of examples, as you said, of the private sector where, pressures on that business having to do all the deliveries, that particular driver, they're really good examples because it is about everyone's job is to think about safeguarding and not just the professionals who are directly employed. So it's a really good example. Keith, I didn't know whether you wanted to say anything at that point, or I'll bring in Lisa McNally as well.
Oh, happy, thank you.
Lisa.
Thank you, Leader. Yes, as Councillor Ross said, it was a discussion at this cabinet which really inspired us to think about how we could design our new Healthy Worcestershire programme, which is aimed at adults, maybe particularly older adults. And it made us think about, what do we mean by health? What is it to be healthy? And yet, to some degree, health is an absence of illness, an absence of physical illness. But I think one thing the discussion you had with Cabinet for me left me feeling was that health is so much more than that. And we can't be healthy if we are socially isolated. We can't be healthy if we are afraid of crime, doorstep fraud, scams. And so when we designed Healthy Worcestershire, we designed it with that concept of health in mind. And it's up and running now. There are hundreds of people attending every week at venues around the county. It captured the attention of Professor Chris Whitty, the Chief Medical Officer, who actually came to a Healthy Worcestershire session not long ago and saw the people there not just talking about health and doing their strength and balance exercises, but learning about fraud awareness and how there are people out there who will take their money off them, but also how they can be confident in protecting themselves. So thanks to you for your inspiration, and of course to the Cabinet for supporting that movement, for Karen, David and so many others who got behind us on that.
Brilliant, thank you.
Thank you, Lisa. I'll just bring in the Chief Exec. Paul.
Thank you. It's all been very self-congratulatory, hasn't it? We've all been thanking each other. I think it's also important to say, though, as I add my thanks to Keith, is that he does also hold us to account. And I think for those people, it's an important point. You know, it's important not to lose the positive. That I think you can hear from Keith that he is pleased with the way the council is operating, but he's not always pleased, and he will sometimes point out what we need to improve. I think the important thing for me sitting here listening is that we are hearing that, we are acting upon it, and we're making the changes. And I think that's a really important role for our independent board, to feel that he is able to tell us, this is where you need to change, this is what you need to do, and he can then report back saying, you have changed. And, you know, those examples of Tesco, those examples of Healthy Worcestershire, are innovation. They are change. They're not traditionally social care approaches that we've had. And I think sometimes we don't hear that. We've spent a lot of time, haven't we, recently talking about how we balance budgets. And, you know, it is important, but we are innovating. Often they're very small things, they're little things, but they make huge difference to people on the ground. And I do think that. I would also want to say, on the partnership front, having worked in a number of places around the country, we are very fortunate in Worcestershire. We have a great relationship with our district councils, and when I say a great, we don't always agree, and I think that's important, that we don't always agree, but we don't fall out. And what happens in other parts of the country, people do fall out, and it becomes personal, and we've never had that. Ever since I've been here, we've not had it. Similarly with the NHS, similarly with the hospital, similarly with the police, we've been very fortunate in terms of that. Probably the biggest turnover has been in the police, to be honest, because they retire so young. You know, that's a constant we've had to deal with. But again, it shows that it's within the culture, because the next people that we get are similarly equally prepared to work in partnership. We see it on flooding, we see it on social care, we see it on children's social care. It's a good relationship. So the big thing for me, I always say this, is the so what question. So we've got good relationships, we've got a good approach to it, we've got a good culture. So how can we be shown to be so much better at adult social care and safeguarding than they are elsewhere? Because there's no point having all these great things if it doesn't lead to a better outcome. So I just say to Keith, if there is anything in future that you need to bring to our attention, feel free to do that, as you always have. We will listen, and we will try and work wherever we can to do the improvement. But thank you for what you've done.
My pleasure. And with that opportunity, I've got to say something, haven't I? And this is not in any shape or form a criticism, it's a warning, really. I think the thing that we're going to be thinking about and vexed over the next few years is coercion and coercive control. We are just beginning to understand something nationally about the scale, the size, the depth of the problem. Domestic violence, coercive control, these areas are just going to make our work even bigger and more important. But how we resource and manage that is going to be tough and difficult. But it's coming, and we need to respond, and we need to deal with it appropriately and reasonably.
And it's an important point maybe to draw the discussion to a close, because there are always those challenges of the future that sometimes you can't see when you've got your head down doing a particular piece of work, or the challenges in the finances which are coming our way, which we need to prepare for.
It's just it's recognition that we don't know the full... The problem is not this defined, it's getting bigger. And that's our problem as a society, isn't it? That's our problem in this area. It's just becoming, we're understanding more and becoming bigger and bigger and bigger, which demands more response and more resource at a time when we're under unprecedented pressure. And that is going to be our challenge.
And technology is driving some of that as well, because you only know what you know, but obviously as more information is spread and people more awareness, then you discover things that are horrifying that we wouldn't otherwise know.
Yeah.
And hopefully we can tackle collectively. But can I, because we've moved and seconded the response, can I thank Keith again in terms of all the work that you do, and I know you'll pass on our thanks to all the members of the board as well.
Will do.
And the staff, Paul, within the service that we're responsible for. Richard.
If I may just say one thing, because it was a really nice moment yesterday that we paid respects to Simon Davis, who sadly lost his life as a data analyst at Worcestershire County Council. And I really thank Keith and the team for honouring his memory, and it was really good to see his mother and his brother attend to receive an award. So thank you.
Pleasure.
Well, thank you, colleagues, and thank you, Keith. It's moved and seconded. Can we agree the response? And we'll move from adults to children's. And firstly, I want to ask maybe Steve McKay whether you want to introduce the response, and then it's a double Steve. So then Steve Eccleston in terms of the actual report. And again, I'll look to David Chambers as our other cabinet member to second. So, Steve.
Yes, thank you, Leader, and good morning, Cabinet. I'll leave the professional bit to the professional Steve. Yes, to introduce, may I first take the opportunity to ask you all to accept the recommendations in the report 1A and 1B, which produces the report and notes the progress of the work. As you said, Leader, the report will be presented by Steve Eccleston, the independent chair, who will in the first instance explain the reasons for the longer reporting period on this occasion. But I will say that this report provides a comprehensive view on the efforts and progress in safeguarding children across Worcestershire. The key areas highlighted include the Get Safe initiative to address child exploitation, improved quality assurance practices for child protection, and important updates on multi-agency collaboration to ensure that the child welfare in Worcestershire remains most pertinent. I would like to say a big thank you to the work by Steve and those who assisted in the compilation of this report. It does exemplify the excellent work undertaken by those working in the multi-agency environment to do their best in attempting to ensure the safety of the young people within our county. And that particularly is in relation to the work, I believe, within the auditing procedures that have been undertaken, so instrumental in the learning processes that have gone forward. So with that, really, I think I'll ask Steve to continue with the presentation of the report, and thank you very much indeed.
Thank you, Steve, and welcome, Steve Eccleston, in terms of the report. Do you want to take us through? Yep.
Thank you, Leader. Yes, and thank you, Steve, for the introduction. Which is Safeguarding Children's Partnership Yearly Report. I'll explain the 18-month coverage of the report first, because I know that has raised a couple of questions. We started doing our yearly report from the date on which we transferred from a board to a partnership back in September 2019, and we took it in 12-month chunks. We have had, so obviously our reporting period ended in the October of the following year. We have, in December 2023, had a revision, quite a significant revision of Working Together to Safeguard Children, which is the statutory guidance which governs many things, one of which is how children's partnerships work. They said, right, yearly reports, yes, mandatory, but must run on the financial year footprint from now on. So all we've done is we've captured an 18-month period to fall in line with the statutory requirements from December 2023. Hence the slightly longer reporting period. Mentioning Working Together to Safeguard Children December 2023, that has formed a significant proportion of our strategic work as a partnership over the last 12 months, and I'll talk more about that when I talk about the work of the executive. The report itself, it is a lengthy report. It's 50 pages. I make no excuses for that. I do like to ensure that we capture a lot of the work that we're doing on a tactical level. I think it's important that we're transparent about that. It is a published report, but also the report is shared with the National Child Safeguarding Practice Review Panel and the What Works Centre for social work, where they are looking to identify best practice from what's going on around the country, and we need to provide them with that opportunity. And as such, hence the volume of information within it. I obviously won't go through all of that. You wouldn't want to hear it all. I will highlight, and what I'll do is I'll highlight, as I normally do, around the groups and subgroups and the work that they are doing or have done over that reporting period. What I would say about the report as well is, as ever, I've set it out as this is what we identified we needed to do during that reporting period. This is what we've done to try and address that, and this is where I still think we've got gaps, challenges, areas for future work that we're working on now this year. So to come to the executive first, which is Safeguarding Children's Partnership Executive, it has been primarily focused on two areas. The first is the work coming out of the National Child Safeguarding Practice Review Panel. There are a number of briefings come from that panel, which is part of the Department for Education. They will conduct their own national reviews as well. One of which was children with disabilities in residential care settings as a result of some incidents in the north of the country. The executive has been very, very careful to follow up in detail on Worcestershire's response to that. Worcestershire, like dozens of other local authorities around the country, had a small number of children within those settings, and it was important to ensure that partners, the safeguarding partners, had learned from those recommendations and taken forward the learning from that, and we have been assured of that. The other area is, as I said, Working Together 2023. It has introduced a number of significant structural changes to the partnership. I won't go through them all. Such things as the concept of a lead safeguarding partner, very specific, chief constable, chief executive of the ICB, but also delegated safeguarding partners. And we've done a lot of work to ensure that we have the right people in place with that, the right connections between them, and those different levels are performing the correct functions. For example, we now have, I'm very grateful to Superintendent Gareth Morgan, who's now chairing the executive, the Worcestershire Safeguarding Children's Partnership Executive, because another of the changes is that independent chairs of safeguarding children partnerships will no longer be allowed under statutory guidance post the 31st of December 2024, and we need to move to an independent scrutiny role, and we're just working through that as we speak as well. Other specific changes or particular changes within Working Together that we've been working to introduce through the executive Strengthening ties with the education sector, with the voluntary, charitable sector, involving them within the safeguarding arrangements. They've made very clear expectations of what senior managers should be doing, middle managers and practitioners within each partnership. And all of this, although it is really detailed, we need to make sure that it's embedded within policies, procedures, and that people are doing the right things at the right time. Another aspect that Working Together 2023 has highlighted is the need to increase focus on harm outside the home for children and young people. Those risks that, yes, some are captured within GetSafe, but it is broader than that too, and that is work that we are currently doing in this reporting period. So lots to do, and lots of activity being done around that. Moving on to the GetSafe Partnership Group that I'm sure you're all well aware of, the GetSafe structure within Worcestershire. It was innovative at its time when it was introduced in 2019. It is very strong. It's been well embedded within Worcestershire, and we've continued to promote that, to work within it. Specific areas of work within GetSafe is, as Keith to my right here has already alluded to, the CALM framework for adults, adults at risk, making sure that young people when they reach 18 years of age who may be at risk of exploitation can move into that CALM process smoothly, and the process is joined together so that protection, that support can continue into adulthood where that young person isn't a care leaver. Obviously, where that young person is a care leaver, they have that statutory protection anyway, and ongoing involvement to 25 with the local authority. We've continued to look at online safety within GetSafe, and this is being blunt, this is not something we will ever fix. This is something we're going to have to keep going at and doing all we can to make sure not only children and young people are kept as safe as possible online, but also, and I think possibly more importantly, parents and carers understand A, the scale of the problem, B, the risks, and see what they can do to contribute. And as part of the GetSafe work, what we have done is we've actually sat down with young people, and I'm very grateful to Young Solutions for affording us access to youth clubs around Worcestershire. And we went and sat down with young people, representatives from the Safeguarding Children's Partnership, and just talked to them about online safety. And we got some very interesting feedback from them. We were asking them such things as, how many of you have got safety controls on your phone? And a surprising number didn't. How often do you have your phone checked by parents, carers? A lot of them don't. Comments such as, well, I have to show my mum how to use my phone. And this is the sort of issue that we're facing here. Talking with these young people was great. They were incredibly open, incredibly straight with us, and it was time very well spent. Concerning was, some of them said, well, if I was in trouble online or felt I was in trouble, I wouldn't feel able to seek help. Reasons being, and we asked the question why, reasons were I'd have my phone taken off me. It might make it worse. And that wasn't the majority, but it is concerning that we have a minority there. Encouraging from the conversation was, we can be reassured that young people are getting the right information, predominantly from schools, education settings, which is fantastic. Education, a really important part of the Safeguarding Partnership. And that is where they're getting their information from. And we've been able to feed that back into our Head Teacher Education Safeguarding Steering Group and saying, look, you're absolutely doing the right thing, please continue, but also think about how within that curriculum you can encourage young people to have the confidence to come forward should they feel they're in any way concerned about an online situation. There's a lot of detail within the report around that, and I think it makes for interesting reading. You will see within the report I've highlighted, we did some work around almost a show me test as to the data and the information we gather within GetSafe and police intelligence coming in, and the fantastic information we get via the REN system that have been introduced by Worcestershire Acute Hospitals Trust around young people coming in with keywords like stab or knife or various other such keywords. How are they all being brought together? I've highlighted there that we found within those district tasking processes that some areas are stronger than others, and there is areas for development there. It's recognised by those areas, they are working on it, but it is something that we will be following up to reassure you. Some systems more developed than others. Talking now about the Quality Assurance Practice and Procedures Group, the QAP group for short. This for me is the engine room of the partnership. Steve's already alluded to the multi-agency audit work that we do. We have, through the reporting period that we're talking about now, we've done 6 multi-agency audits covering a number of different areas, and these are real deep dive dip testing of cases. Look at the notes from a strategy discussion. Who was there? Were the right people there? Were the right decisions being made? Were the right discussions being had? Was the information being shared? And if not, why not? We've produced a number of learning briefings and circulated those widely from there. And what we also do via that QAP group is, in relation to the individual agencies learning what they identify their own within their own agencies from those audits, we do follow up and hold to account with, well, okay, then you identified this, what have you done? And that is reported back. And I give examples of how that has changed, not only single agency practice, but partnership practice within the yearly report. I think the most important of those audit activities was in relation to domestic abuse. Children and young people living with domestic abuse. Number of drivers for that audit. Firstly, we had the Child Protection in England report published in May of 2021, I think it was now, which was a national review done by the national panel following the death of Arthur Labino Hughes and Star Hobson, which I'm sure you'll all recall. There was a very clear recommendation in that, recommendation 8, to Safeguarding Children partnerships, saying, I paraphrase, there needs to be greater focus, greater scrutiny on children and young people living with domestic abuse. And there was a follow-up briefing from the national panel that highlighted, of the hundreds of cases that get reported of children suffering serious harm, within those cases, domestic abuse, it features in 40% of those cases. It's not the main causal factor for the harm necessarily, but it's within the household. So you can see there that there's those national drivers. I'll talk more about the Alfie Steele, the tragic case of Alfie Steele and the Child Safeguarding Practice Review that followed that shortly in more detail, but it also featured within that review. So we took cases at both an early help level and at a child protection level. And we were able to identify some good practice. There is good practice there, and it's not all about it's not a deficit model that we run here, is it? We've published both the learning and the good practice that is available. We've also got that learning out via our response to Alfie Steele, which again I'll talk about shortly. We've shared that with the Domestic Abuse Partnership Board. There is areas for the Safeguarding Children's Partnership to focus on, and there is areas for the Domestic Abuse Partnership Board to focus on. And I think it's really important that we remain working closely with that Domestic Abuse Partnership Board, so we're not overlapping, we're not duplicating, but most importantly, we're not leaving any gaps. We will continue to respond in that manner. The other thing that, just an example of the other sort of work that the QAP group has done, we've reviewed our neglect assessment tools within Worcestershire that are used by multi-agencies. We involve children and young people in that. They are, practitioners will use them as questionnaires for families, what do you think is going well, what not so much. The feedback we got from children and young people is they're a little bit professionalised, soften them, use better language, and that was really helpful. And as a result, with a collection of partners, we've been able to review those and republish them. Moving on to the Child Safeguarding Practice Review Group now. This group primarily looks at where we have instances of serious harm to children and young people. Serious harm is different to a term which many of you will be familiar with, which is significant harm to children and young people. Significant harm is the threshold for which child protection procedures kick in. Serious harm is it's a level higher than that. It's where we need to start considering child safeguarding practice reviews, safeguarding children reviews, serious case reviews in old money, as some of you may still remember them. And there we're talking obviously loss of life, life-changing, permanent harm, etc. We have, within the Child Safeguarding Practice Review Group, we've published during this reporting period 2 child safeguarding practice reviews that we've completed. The first was in relation to, it was a thematic review resulting from a case, and we haven't published the full report in this for very good reason, and that is that the detail was too sensitive to make public, but we have published an outline of the review and the learning from it. And this involved looking at children and young people who were living in homes where registered sex offenders also lived or had access to those homes, those families. Were the risk assessments robust? Were the right people involved in those? Were the children, young people being adequately protected? And as I say, the learning has been produced and is available on our website there. The second of the child safeguarding practice reviews that we published, and we did so in late January, early February 2020 of this year, was the review into the tragic death of Alfie back in February of 2021 in Droitwich. I'm sure you will all have been aware of the case and will have seen the media attention that it attracted. A dreadful set of circumstances. I'm grateful to Jane Whiffin as our independent author who completed that review. It was a very, and we welcome this, a very intrusive, very objective review that came out with some very clear recommendations that I think were both balanced and realistic. And a lot of the work of it was the Child Safeguarding Practice Review Group's responsibility to deliver that report, make sure it was delivered on time with the appropriate agency contributions. And I'd also like to record my thanks to all of those agencies involved for the openness and transparency with which they approached that review. It's clearly difficult for agencies, and it's clearly even more difficult for those practitioners that were actually involved with Alfie and his family. And as difficult as it was, they were all willing and able to engage with that review. So I am grateful. So it was published. We had these recommendations. The role of the Quality Assurance Practice and Procedures Group, the QAP group, then took over, and that was to deliver against those recommendations. So it's all very well having a quality report, but it's about what difference does it make. And rightly, we as a partnership expect to be held to account on the basis of how have you used this. It was wide-ranging. The report, the areas that it covered were wide-ranging. Domestic abuse featured within that, response to domestic abuse. Unfortunately and sadly, there were things that have featured in any number of other previous reviews, both children's reviews and adults reviews and domestic homicide reviews, when we talk about confirmatory bias and professional curiosity and supervision and these, and you know that they're easily highlighted and easily written into a recommendation, far more challenging to address and change permanently. We have to be realistic here. We've already talked about turnover of staff. You know, we're asking, and I keep making this point, we're asking often youngest, most inexperienced practitioners, be they from children's social care, be they health, be they police, to go in and deal with some of our most challenging adults within our communities, challenging, intimidating, switched on, and able to avoid that sort of scrutiny. So whenever we draw conclusions from these reports, I think it's always important to bear that in mind, and as senior leaders ourselves, to think how can we support those young practitioners in doing this. So our response, we've held a series of webinars now. I think we're up to 5, each of them attended by over 100 practitioners from across the partnership. So we're reaching out to hundreds of practitioners, delivering the learning, explaining why we've reached those conclusions, explaining what they need to do in relation to considering how they approach practice. We've then followed those webinars, sent out a quick couple of questions. What are you going to do differently as a result of what you've heard? We've had those back in. We'll be following that up in 3 months' time to say, well, how has this actually changed and what have you actually done? And what we're looking to do is be able to demonstrate not just outputs, we have reached 600 people on webinars, but outcomes, this is what's changed. And this is something which constantly from the national panel, and rightly, we're challenged to, well, okay, but what are your outcomes? How can you evidence things have changed? And it can be quite anecdotal, but I was really encouraged, I think it was the week or the week before last, to hear a probation service representative within the partnership. We were talking about, what next and what do we do and how's it going? And the probation service representative said, well, look, he said, as a result of those webinars and confirmatory bias, we've had a small number of cases where professionals have said, stop, hang on, I think we are being professionally optimistic here. I think we are displaying confirmatory bias. There's been challenges amongst professionals which have led to different decision making, which has actually led to individuals being recalled to prison who pose a risk to children. Well, it's small numbers and it's anecdotal, but that for me is an outcome, a demonstrable outcome from all the time and effort that's been put into partners with delivering these messages. We've reviewed a number of different guidance policies that that are owned by the partnership and within single agencies. For example, trying to clarify guidance for practitioners around physical chastisement and physical abuse, and when does physical chastisement become physical abuse. And again, these are tricky decisions for our practitioners. We can't lose sight of that. They're not always working with laws, statutory guidance, which are clear. They are open to interpretation. And I know we've had this conversation as well. Look at the Domestic Abuse Act that has come in, and children as victims, and how do we work with that? So we've issued further guidance on that. On professional curiosity, all of them are available on our website, and I invite you to have a read and see what we're doing there, and we have circulated them widely. There has been really strong single agency responses as well from this. I've already mentioned the probation service. The probation service has worked closely with what was Worcestershire Children's First, Worcestershire Social Care, Children's Social Care, to ensure that the information sharing and the discussions that take place between probation service and children's social care are robust. There's proper mechanisms for that. I know there's been a comprehensive response from West Mercia Police, driven by Deputy Chief Constable Rachel Jones, to the learning for the police from the Alfie Steele case, and that continues. And so and we will continue to follow that up and report in depth about that learning and the outcomes in next year's yearly report. Final group I'm going to talk about is our Education Head Teachers Safeguarding Steering Group. This is a group which is really important to the partnership. I've already highlighted one aspect of the importance of education. Working Together 2023, again, tries to strengthen our engagement with partnership education settings. I'm actually very proud of the structure that we've got in Worcestershire here. It has been copied by other areas. We're ahead of the game here, so you know, it is something I think that we can show we've been ahead of the game with. Education, Head Teachers Safeguarding Steering Group, supported with promoting Get Safe. Huge amount of work done by our education safeguarding colleagues around expanding Operation Encompass, the notification of domestic abuse incidents to education settings into early years settings across Worcestershire. And at the time of writing the report, 277 of the 455 early years settings were signed up to the Operation Encompass, received the training and receiving those notifications. I think it's also worthy of note, and we highlighted in the report, the contribution of our education colleagues to delivery of early help, stopping the bad things happen before they happen, getting ahead of the problem. Over 13, the education sector has been in Worcestershire has been able to demonstrate they've helped over nearly 13,000 children and families at an early help level. And within doing that, they have completed over 2,600 early help assessments. So really strong support there for children, young people and families from our education colleagues across Worcestershire. Funding. We were very kindly given a sum of £47,300 by the Department for Education to help implement Working Together 2023, which we were very grateful for. We are within budget. We continue to spend within budget, which I'm sure you'll be pleased to hear. We were able to agree a 2% rise on funding, which, considering the recent inflationary rises over previous years, I think is strong. Again, and Keith has highlighted this in relation to the adults world, I think it's a really strong piece of evidence around Worcestershire as a partnership can come together at an executive level and have challenging but sensible conversations. But subject of budgets, there's no better test, is there? Have sensible, challenging, but come to an agreement over this and then deliver. And I am grateful to all there. Going forward, in this current reporting year, I've already mentioned the follow-up to Alfie Steel learning, and it's important that we deliver against that. Domestic abuse, children and young people living with domestic abuse continues to be a key area of focus for us, and we're now following up with single agencies around what are you doing about, have you implemented it, and continuing to work with the Domestic Abuse Partnership Board in relation to that. What services are out there? Are they adequate? Are they doing what they should be doing? Volume of referrals to Family Front Door, always a challenge. Again, it's painting the fourth bridge, to be honest, around this. We continue to audit, we continue to get the messages out, we continue to develop our database to try and identify what we can do differently, and that is something that we will remain focused on. Response to serious violence, and this encapsulates the area of development. For example, a small part of that is the local tasking processes. Something that we're looking at this year in relation to Get Safe, the exploitation side of it in relation to child sexual exploitation and trafficking and county lines. Yes, okay, we've got that well captured within Get Safe, but that harms outside the home, the gang and youth violence. Where are we with that? Who's got it? Where's the response taking place? Is it robust? Have we got all the gaps covered? And we've sat down very recently and tried to map out where all this belongs, exists, the work is going on. You've got community safety partnerships, you've got local criminal justice boards, you've got the Child Safeguarding Partnership Get Safe approach, you've got community safety boards, all with a view on it, OPCC in relation to the serious violence duty. And we're just embarking on a piece of work using the Joint Targeted Area Inspection model, the JTI model, being used in other areas to say, where are gaps? How do we improve them? What do we need to do? Because harm outside the home, gang and youth violence, I see as something that we are not as confident about who's doing what as we should be. There is good work going on, but we just need to be clear on where we are. So that's the work for this current reporting period, and we will update on that in the next year. And that's it. Happy to take questions. Thanks, Leader.
Thank you, Steve, and thanks for a very comprehensive coverage of the report and really bringing to light the breadth of the partnership. You know, the amount of things that you covered talking through there really struck me. And you're also dealing with what is societal norms. You know, I'm just thinking of some of the debate that's going on in terms of the use of social media by children and young people. The debate going on across the globe. You know, Australia taking very strong stand, actually, I think, in terms of under 16s not being able to use and have access to social media, and obviously the government may be looking at what is right and proper for the UK. The amount of phones, smartphones, the technology that exists, which even a few years ago just wasn't in place, to be honest, and the expectations. And the other thing that I thought really struck me was how much we were asking of quite young professionals, actually, in all sorts of spheres, whether it's policing, whether it's some of our child protection work, whether it's young teachers, actually, in terms of making those judgments, balancing off over those issues, and the expectation that they're always going to get it right. And we know that, unfortunately, that there will always be a case that demonstrates that hasn't been possible, and the learning that we take from that. But I'll invite contributions from colleagues, and I might look to David first in terms of...
Thank you, Leader, and thank you, Steve, for an extremely comprehensive presentation. Just Simon mentioning social media more, I made a note, really just to keep in my own mind, when you referred to so many things. But when you said you met with those young people and you asked them to do with online concerns, and if they would tell someone if they were worried, and they said to you, well, no, and you asked why, and they said, because I probably have my phone taken away. And of course that is something that is relevant to virtually every family, because so many children, if not most children now, have phones. But thank you, and also thank you to your safeguarding partners for all the work that you've done and that you will continue to do on our behalf. As the CMR for Education, I just would like to pick up a couple of the points which you've already covered, to be truthful, but which I was particularly pleased to see. To note that the Education Teacher Safeguarding Steering Group has continued to promote both the Worcestershire Get Safe and Get There provision, and raise the awareness amongst staff in their settings about the risk of child exploitation. It's also reassuring to note that Operation Encompass involves the reporting to school before the start of the next school day of when a child or young person has been involved in or exposed to domestic abuse. It's similarly reassuring that this process has now been extended, as you said, to the early years setting. The report states that the Education Head Teachers Safeguarding Steering Group has undertaken work to promote and develop early help in education, with 100% of Worcestershire schools having their own early help offer. And as you said, they've supported nearly 13,000 children, and in doing so have completed 2,684 early help assessments, showing strong evidence of both the engagement of education settings in our early help arrangements and the extent to which those settings are providing support to children, to young people and to families. So finally, thank you again in great sincerity for all you do and all your colleagues do in supporting the safeguarding of children in Worcestershire. Thank you.
Thank you, David. I'll bring in Mark, maybe wearing another hat as opposed to the Cabinet Member for Highways.
Yep, this time I'll be the local member for Bowbrook, where unfortunately Alfie Steele met, his family lived and Alfie died. I was really interested in the details of the things, and I was really pleased to hear about the focus on real change rather than communicating details, because I think, as you said, Steve, an awful lot of these sort of serious case reviews tread the same path, and I think what the public would really like to know is what are the 2 or 3 most important differences that you think will come out of the review in practice as a result of your work, that will hopefully, you'll never make this certain it will never happen again. I appreciate that. But what makes it less likely, and what are the most important 2 or 3 things in changes that you think will result as a result of it?
That's a very good question. And for me, I think the most important changes are not procedural or structural. They are empowering practitioners to have the confidence to challenge their own initial thoughts and perceptions, and also challenge what they're being told, and be more robust with individuals when they are dealing with them. I'll give you a simple example from the review, when Alfie's mother was saying, no, he's not here, but it was reported that he was in the house. Be confident enough to say, actually, we don't believe you, and we want to take this further. And simple things like that, and knowing they will be supported with that. Another is highlighted within the report, and one that struck me while we're talking about domestic abuse, and this highlights the complexities of what we're dealing with here. And we've already talked about coercive control, haven't we? It is within the report that Alfie's mother was a victim of domestic abuse in a previous relationship. There was no evidence with this current relationship with the individual that was in the home when Alfie died and was convicted of his murder that there was domestic abuse going on. There was an assumption that there must be, but back to confirmatory bias and professional curiosity, where was the challenge to actually, is mum fit and able to protect Alfie? And if she's prepared to hide this individual who believe is a risk to Alfie in the home, the answer's no. So rather than just thinking of her and determined to think of her as a victim herself, we need to work with her, actually challenge that initial professional perception. Is she a protective factor? And if not, let's do something about it. And being more professionally robust, I think, in these situations. So those are the 2 things that I'm looking at. Very tactical, very subjective, and I mean, just to use, I don't mean as a flippant way, but I've often said during my career when I've dealt with this and having sort of spent time in professional standards in a large organisation as head of professional standards, I often used to challenge, how do we put an old head on young shoulders? And that's the challenge we face. And the reality is we can't, but we can support them in that direction and help to give them that confidence to challenge in that way.
It's also recalibrating, isn't it, as new information comes in, constantly relooking at some, saying, is that judgment still right? Yes. As things progress, and that's often quite difficult, real time, with dealing with lots of different agencies, different pieces of information in challenging circumstances. Very difficult. I've got a range of speakers, and make no apologies for that because it's such an important topic. So I'll bring in David Ross, and then Karen, and then Adam.
Thanks, Leader. Thank you, Steve, for that comprehensive report. I was going to talk about the Australian initiative on social media. My view on it is I'm not sure it'll work, because I think that trying to restrict social media to under 16s, prizing their fingers off their smartphones, will not work. But we'll see what happens, and we'll see if it's something that this government may wish to consider. But my real issue was regarding domestic abuse and your comments on what I call the hidden victims of domestic abuse, which are the children. And not only the fact that, as you say, in 40% of domestic abuse cases, children are harmed, but not just the physical harm they undergo, but for those children that aren't physically harmed, they suffer the mental abuse and the mental stress of being in a household that has domestic abuse. And, Leader, I make no apologies here for pleading once again with this government to continue with the grant to the county to support our work on domestic abuse. And I thank you for highlighting the importance of the work that the Preventing Domestic Abuse does with regard to safeguarding of children. Thank you, Steve.
Thank you, Councillor. And yes, absolutely. And I've already had a conversation with Lisa, but if there's anything that the Safeguarding Children's Partnership can do to support that, then we'll be more than willing to do so. Please don't say that, because a child or young person has witnessed live with domestic abuse, they are going to themselves be a domestic abuser. That's absolutely not fair. However, there is that link between that normalisation of those sort of behaviours in the environment in which they're growing up and a potential risk in the future. Plus, it is that ongoing emotional harm. And in fact, the most recent child safeguarding practice review that we've commissioned is exactly around emotional harm caused to children as a result of a domestic abuse incident. And where this comes back to, yes, we can call, within the change to the Domestic Abuse Act, we can call now children victims in their own right. I think that's really important, not from any charging or court process. It's really important that it emphasises the importance that the support services need to be in place for children and young people who are living with domestic abuse. And if that piece, changing that legislation, increases the focus on that and the importance of it, then it's done absolutely the right thing.
Karen.
Thank you very much, and thank you again, Steve. I'm not being sycophantic. This really is, it's almost like the end of year report, but also the highlight report into how we need to fix and address the concerns and the challenges within the whole system. You made reference to professionally robust. How do we upskill and, as a society, not criticise people that are very robust in their challenging? We need to, from a safeguarding perspective, and this goes across adults and children's, it's a common denominator. And as a society, when anybody is challenged, they see it as a personal vendetta almost. We need to change that dial and address this, because unless we are professionally robust and we upskill people and we have the tools in our kit to do it, we'll never get to the underlying causes, and in addition to that, then the outcomes from the work we're trying to do. I thank you also for highlighting the early preventative work. We've had many conversations as a Cabinet about prevention and how you measure prevention and the outcomes. Prevention will come out in future generations. It's not short-termism. You're in for the long term. But I feel very passionate about early help intervention, prevention of people, be it stable, core strength with an adult. It's how you take those actions throughout life to influence the outcomes. And I note very keenly the 13,000 people that we've potentially protected with our preventative agenda. And in both of your reports, you've highlighted why it is so important we as a county council allocate 70% of our funding to the 2.5% vulnerable people in society. And that narrative, if anybody from the government is watching, needs to be listened to. Because these are the vulnerable people. And if you don't address health disparities, you don't address these needs in society, we'll never get a change. I never want to see another Alfie Steele. It was heartbreaking to sit through it. And the late Cabinet member, Andy Roberts, I can remember him being in tears over this with me. And we were talking it through and saying, how can you challenge if you're personally criticised for that challenge? I think society needs to recognise that challenge is coming from that place that we want to protect. And it's not personalised, but we need to upskill and we need to, as a society, as I say, address this, because if we don't, we'll never fix this at any level. Thank you.
Do you want to respond, Steve?
Yes, thank you. I absolutely agree. How do we get that confidence, build that confidence to challenge and be robust? It's a number of things. Certainly the training that we give to our staff is one. I think supervision is a really important part of this, and not supervision in the day-to-day sense of what's your caseload and is it on time and this sort of thing, but it's about sitting down and having those conversations around decision making and instilling the confidence in the younger practitioners to be able to go back and know they're doing the right thing. And from a safeguarding supervision perspective, some agencies are further along the road in relation to getting this right than others, I have to say. But it's also then instilling the confidence in these young practitioners that, you know, accepting people will, and you know, some of us in our own professional lives will have had this, and it's hard, particularly when you're young. Those people that you're then challenging will use the complaints process against you. They will be incredibly vocal, incredibly robust. Particularly, I've found in my professional experience, those who are perhaps better educated, more literate, more confident in the way that they approach things, it can really get quite challenging, and that's where that young professional needs the support of their supervisors and their managers. If it's been inappropriate, if they've got it wrong, well, okay, accept that, learn from it, move on, and have the support to do that. But yeah, I do think it's all about the support from those supervisors and those managers that have got the experience and have reached that point because the organisation recognises that.
Adam.
Yeah, thank you, and thank you, Steve, for the report. I suppose, as we spoke about before, I brought the original motion to council on Get Safe several years ago in terms of that's triggered the awareness of the programme, which was somewhat under the radar previously. From personal experience, I mean, I don't think this is particularly just current times. This goes back quite a long time, particularly with involvement with drugs and things like that. But I suppose for me, listening today, and I've just had a look at the Get Safe Child Exploitation Risk Assessment, and down the bottom under home and family, there's parental capacity. And I think with what's been spoken about societal changes and the way that people think differently, I'm just wondering in terms of early prevention, that situation through pregnancy and other times where we can actually clearly identify where there might be risk factors to flag up the situation, so we're not reacting to something, we're actually able to support people to make sure it doesn't happen in the first place. And I certainly see, and I'm sure many of my colleagues do, that it's now become, certainly in certain sectors within our society, that it's the belief that it's the state's problem and not the families. And I'm just really, I suppose, coming on the back of what Karen's just said, wondering what we can do more to even go down to that point and make sure that at the point of even pregnancy or even prior to that, that people are thinking very clearly about, am I suitable to be a parent at this particular stage? And if we do identify that there are issues, what we can do to help to try and negate potential impact of those issues.
Steve, did you want to pick that up? I've got a range of other speakers.
Yes, thank you. It's a really interesting point, and it's one we could get into a real sort of theoretical debate about how liberal do we want our society and this sort of thing. It's not somewhere I'd want to go, to be honest. But there are efforts made. There are mechanisms there. You look within the education sector now at within the curriculum around the health, personal health and PSHE section of the curriculum they call it, and it's all aimed at trying to do that. Yeah, I don't have a simple answer, and I'm conscious of the time. I'm sorry. You've raised a very good question. Debate.
I've got a range of professionals I'm going to bring in as well from the council. Sir Adam Johnson first as the director.
I could talk all day about this, and I won't. You'll be pleased to know. You've heard from Steve. That our world doesn't stand still in any sense whatsoever. So working together, that in its own right, just by way of example, huge amount of work that's been undertaken, huge amounts of work to be undertaken. Domestic abuse, serious violence, safeguarding practice reviews. Again, you can't state the amount of work that's been undertaken, the learning that's been undertaken, and then the application of that learning before we even talk about the impact and how significant that impact is upon our community, upon our workforce, with the expectation that we improve and we take on board that learning, and I believe that is what's happening. It sort of goes back to a comment that Paul made right at the beginning. We've still got to ask ourselves the so what question. the culture that we have in children's services is absolutely high support, high challenge, and absolutely the lived experience that I have and others have, and they report back in terms of Safeguarding Board, is very much the same ideology, the same philosophy, high support, high challenge. I think you've heard it today with Steve's summary of the annual report. The support is absolutely there, but the expectations alongside that are also clearly there. And again, going back to Councillor McKay's opening comments as well, to introduce you, Steve, for the report, the importance of the moderated audit process, the multi-agency audit process, the QOP, the engine room that you spoke about, Steve, that is the answer to the so what. Are people taking on board the learning? Are agencies taking on board the learning? Where is the evidence of that? And then how do we take another step forward and continue to do so? Get Safe is a really good example of that. There will always be a need for Get Safe. There will always be a need to develop that going forward, and it will never be cured. That's life. That's human beings. That's what we operate in. But very much a high support, high challenge atmosphere, which I think you've heard from Steve himself.
Thanks, Adam. And I'll bring in Paul, so the Chief Exec.
Thank you, Leader, and thank you, Steve, for the report and all that you do. I think for me it's just about, I guess in my position, it's very much about assurance. I leave the professional world to Adam and the check and balance to yourself, but it's important for me to get that assurance. And I think some of the things you said today are really important, just to give examples to. So we are ultimately talking about risk management here. The whole basis of our child protection system is based on what is best for the child and how do we manage the risks that they might face. And Adam has come a long way in terms of his service, in terms of, historically what we did is we intervened and we took children into care. If you look at all of the outcomes for care, they're not necessarily in the best interests of the child. And so we are left with a place now, as theory has moved on, to try and, wherever possible, keep the child with their family or their extended locality in terms of the people that they know, to give them the best opportunity in life. But we're then left with managing the risk. And what Steve is absolutely right in saying is we don't always get that right, because there are limits to what questions we can ask. I think there is always an element in safeguarding reviews that, of course, we're looking at it from hindsight. Could we have acted differently? And of course we could. And I'm really keen on that point you say about putting old heads on new shoulders. What you're really saying is about the benefit of experience of having lived some of these cases. And I think, Alfie Steel was a dreadful moment for this authority and for the county and for the community. But on the positive side, if there is one, our people have learnt from that. So, as you say about having that old head, they have experienced it, they know what happened, we've got the examples and the feedback and the learning points from the report, and those have been communicated to our staff. And I would just want to say we have a hugely professional and committed staff. They are very well trained, they are very well supported, and we do whatever we can to try and meet that expectation. But this is a changing world. 10 years ago, there was no TikTok. 10 years ago, it started with Facebook. It's Facebook, it's TikTok, it's Instagram, it's Telegraph, it's whatever's coming next. What will phones be able to do with AI? What will children be able to ask a phone? We might think of things we'd ask AI for. We've talked with Adam a lot about, Adam Kent, Councillor Kent, about what ChatGPT can do. Well, what could a child do with that? Where could it take them? What could it bring them back to? What will the algorithm then pick up from that? These are hugely open-ended questions that we don't know. If we go back to when I was a child, it was cinema, and there was a fully position in terms of people who put an age rating on it. Where is the age rating for these videos that are online? I look at it from my own experience, and that's possibly where an old head isn't necessarily as helpful in future, because if I take my son who is 12, nearly 13, he knows all of these sites. Ones I don't know. you know, so I'll check his Instagram account and I'll check his Facebook account, but I don't know if he's got something called XYZ that I've never even heard of. So it is really difficult. But I do want to pay tribute to the staff that we've got. I also want to say that as an organisation, we don't treat complaints negatively. Adam will have heard me say this, but also Tina, who was the previous director, saying that I believe the process is there to protect people and to actually move things forward. So if we do get a complaint, by all means, let them complain. And we will look at it, we'll investigate it, and if there's nothing to answer, we will say there's nothing to answer. And on that basis of supporting the individual, you have to have the process, because the person will continue to create noise if you don't. And we did that on a number of occasions where it had gone through a number of iterations in WCF, and then it came to me and we did it again. And then we said, you know, you've got no case to answer. You might not like what these people are saying, but actually it needs to be said, and and we supported them in it. So I think we are learning as an organisation. We are open to that challenge, and we don't always just back down. We absolutely see it through. And I think the reason for that at the end of all of this is, if you look at lots of things that then end up in Mark's world or end up in in terms of adult social care, adverse childhood experience is shown in an awful lot of cases to be behind drug use, to be behind homelessness, to be behind mental health issues, between worklessness. So actually the investment into prevention, the investment into getting this right is absolutely the right thing. And it's not just about children, it's about their lifetime. It's about when they become adults, it's about how they will react with the world. So we are very committed to that. I do want to pay thanks to the staff, and I also want to say that it is important that you are very clear and critical when you need to be, but also give us those clear action points, because we will learn from them. We have implemented them in the past and will continue to do so. But thank you very much.
Maybe we'll wrap up with Steve McKay. Is there anything you wanted to add?
Yeah, thank you, Leader. There's only a couple of things in the report that I think I'd like to bring out, and that is the paragraph 12 of the on page 7 talks about the online problems. We've heard a lot in the media just recently about online abuse, and it's clear that schools have a part to play in this. But I was very pleased to see also that joint online safety conferences is going to involve parents and carers, because we must not forget that there is a responsibility to the parents as carers, as well as our statutory responsibilities that we hold as well. And additionally, Professor Brown mentioned about the issues in relation of domestic abuse and how we're going to see further. And I think it's fair to say as well that it's right to show that I'm sure he's right, because we are already seeing an increase in children coming into care or child protection matters in relation to domestic abuse, because the category is around emotional abuse. So I think your thoughts on that are absolutely right. So yeah, once again, Steve, thank you for the report.
And I'd echo those comments that have been made by people around the table, including the Chief Exec, about thanking our staff and professionals who work across Worcestershire, not just for our organisation, but protecting children, those people in schools, the people in the police, etc. And you, Steve, for the work of the partnership, because we spent a long time this morning, but it's an investment in how serious this council takes these two topics, which account for the vast majority of what we do. And I talk to a lot of members of the public and stakeholders, and sometimes that isn't the first thing they think the county council does, but it is the thing that we come back to. It's our core in terms of protecting vulnerable children and adults, and rightly so. So thank you, Steve, and thank you, Keith. Can we agree and note the response? Okay. Colleagues, we will just we'll move to the next item, which is very pertinent. We've had the debate and discussion, because actually the next item is all about the resources report and the progress at the halfway point in the financial year. And so, colleagues, I will move the recommendations, which are one little A to E, as set out there, and just bring to life some of the key aspects in the report. As I said, the report covers 6 months of this financial year, and as you can see, in terms of the challenges that we've laid out and we've had to fund, in terms of children's and adult social care, some of the issues we've been debating this morning, which are relentless and they don't go away in terms of those pressures. Very much also talk about this report, which is a really good report from the CCN Newton that was launched at the CCN conference that we contributed to colleagues. And sometimes we don't talk about a lot of the work that goes on behind the scenes in terms of not just older people in adult social care, but actually the working age disability and lifelong conditions. Very thorough report, of which over 50% of adult social care budget now goes on working age disability and lifelong conditions, not just the older people that people think about, very important, but instantly think about when we talk about adult social care. And those pressures in children as adults and home to school transport and SEND continue. Whilst we resourced significantly the budget, addressing the structural deficit that we found some £35 million, and uplifted the budgets to recognise inflation, recognise the pressures in terms of demand on children's adults, homeschool transport, etc. We are still seeing those pressures at the half-year point. And whilst we've been able to mitigate some of them through the actions we're delivering, over 75% of the budget savings, record number of budget savings initiatives and reform that we're delivering as an organisation. I can never remember a time when we've been doing so much on that. 75% of them are green. But there are some actions that are proving really difficult to actually extract the cash or make the change, or even when you make the change, it doesn't have the impact that you expect. So the numbers are moving in the right direction in the sense of addressing that situation at period 6, month 6, with some £12.5 million of overspend and pressure. So we are making an effect there, but I would draw Cabinet's attention to the fact that we are still, overspent in those areas, which we're looking at in terms of children's, adults, homeschool transport, and, as I said, SEND. And SEND, whilst obviously we welcome the additional resources the government's putting in, there's a significant overspend there, despite that, and a significant overspend that we have to service through the DSG higher needs block. And it's been, over the last couple of years, doubling each time. So when we were talking about £20 million potential deficit, we were concerned. We've got to over 40. We're looking at over £80 million. So there's clearly something wrong there in terms of the system we're being asked to operate. And if it was just Worcestershire, we'd put our hands up and we'd say, we're doing something wrong. But we're not. We're doing the right stuff for very vulnerable children, people who need specialist care and assistance. But that's sitting on our books. And whilst there's an override, a statutory override at the moment, we're still having to service that deficit, colleagues, which is costing real resources in the budget each and every year. In terms of the look forward, obviously we also start to note the budget, the national budget, the government's budget. And whilst I obviously always welcome additional resources for local government, some £1.3 billion, we have to wait and see what the numbers fall out in December for Worcestershire County Council. I think we can safely say that the old 1% rule will probably hold true in terms of adult social care, some £600 million of resources. We might be able to look forward to additional £6 million of pressure. We're having to set against all the cost pressures, colleagues, that providers are going to find, particularly in relation to the national insurance contribution changes. Not just the threshold, not just the additional rise in national insurance, but also the living wage going up. So that trio of pressures that providers are seeing are not resourced in this budget going forward. They're not recognised, I have to be honest, to government in terms of the allocations they're making. So £6 million extra, but we might be facing 10 or 15 or 20 million pounds of additional pressure for providers. And again, in terms of our own national insurance contributions to staff, They might be underwritten, but not for all the other providers that we have. So we've got to take a forward-looking, balanced view and say there are significant pressures as a result of the national budget that aren't funded in what we can see coming forward. And lastly, in relation to the £700 million, I'd really urge government to look at how they allocate that, and that they use the traditional tried and tested methods that we've had, because at a time of real change and challenge, changing the formulae in which that 700 million is going to be distributed for a new deprivation-based formulae has some real risks, because we won't be able to apply the 1% rule. We won't be able to say automatically, well, that will be an additional £7 million for all those other pressures and services. We might get a lot less than that. And just at a time when counties and unitary authorities are facing those real pressures, the thing that we spent 1.5 hours this morning debating, the pressures that staff, society, our partners are facing, stakeholders are facing, isn't the time to potentially have an untried, untested formulae in relation to the distribution of those resources. That could put some of our services for the most vulnerable people at risk. And so there is that forward-looking message that I want to get out across today, which is we will be looking, obviously, how these costs will reflect into the budgets of the future, how we'll be able to resource them, the choices and challenge that we face. But I would also say to government, reflect on those choices in the local government settlement, because they will have real consequences for very vulnerable people here in Worcestershire and across the country and many other places. So that's my summary in terms of the report, and I'll look to Marcus to second the points and maybe cover off those issues that I haven't covered off in the capital programme and some of the investments we're making. Marcus.
Thank you very much indeed, Leader. Good morning. Well, I'll start by formally seconding the recommendations on page 13 of the agenda, 1 little a 2e. And indeed, we are looking to the period ending the 30th of September, which is 2 quarters through the current financial year. And there seems to be, and it's absolutely no criticism to us, of course, budget monitoring is absolutely really important, a pattern emerging year on year about our demand-led pressures. And I know it sounds like a broken record, because it's really important that we invest in those really important services about keeping the vulnerable within our communities across Worcestershire safe. And obviously, earlier on in the meeting, we've heard just exactly about that, with both from the chairman of the Children's Safeguarding Board and the chairman of the Adults Safeguarding Board. So it's absolutely part of the core business that the County Council delivers upon in terms of providing its statutory duties. But the reality is we are in a similar boat that is faced by virtually every other upper tier authority the length and breadth of this country. I use the analogy boat. We're not quite up the creek without a paddle, but the waterfall is ever coming closer, and yet again, because of the pressures in our particularly our placement budgets with both children's and adults, we are overspending, and demonstrably overspending. And the report really, and it's really important for the communities that we serve, to be able to demonstrate the sheer amount of money that we spend, and obviously Worcester Children's First, which has come back in-house, has a £7.7 million overspend, and the dedicated schools grant is currently forecast to overspend by £43 million, which on a £261 million budget is not insignificant. Getting on for a 15% overspend, and the figures in Table 2 speak for themselves. It's absolutely right to say that we do have a plan, but of course we started with a structural deficit of circa £35 million, and we are delivering to reduce that deficit, as the report says at in paragraph 13. We had a plan for £37 million worth of savings with reforms, and figures have been allocated to the directorates, and of that, importantly, though, just shy of £5 million remains unallocated, and of course we're at risk of non-delivery. I hope that we will be able to pull some of that back by the end of the financial year. We are, of course, still investing in an ambitious capital programme, as the report sets out at page 26 and 27, because ultimately, of course, what are we as an organisation? We're here to protect the vulnerable. We're here to deliver our statutory services to those that require those statutory services, children and adults, but we're also here to deliver for our wider communities. And there's little, if any, point us being here as an organisation if we're not delivering for our communities. For example, capital investment in Hampton Bridge, and also ensuring a location closer to my home, for example, paragraph 60, an allocation to demolish the Stourport County buildings, which is now redundant, where the magistrates court, the police station was, the coroner's office, the fire station, the library, the health centre. It's been a redundant eyesore for a good while now, and if we can't redevelop redundant parcels of land such as that, very near the heart of our town centres, then frankly we want stuffing. But we are doing it, and that's really important that we continue to do so. Obviously, we make substantial other capital allocations for the projects, the length and breadth of this county, which are really important to our communities. So I hope I haven't painted too much of a bleak picture, Mr. Chairman, in seconding your recommendations, but I think it's really important to emphasise the really difficult challenges that we currently face as an upper tier authority. Of course, everyone wants people to be paid the right amount for the right job, but with increases in the national minimum wage, with the extra burdens on particularly our providers of adults and children's social care, with the additional employer national insurance contributions, and with supplier costs going up, it all adds to our pressures as well. And these are decisions that are being taken centrally, which ultimately affect us as a county council, and ultimately affect the residents that we serve and represent. So happy to second the recommendations as printed, Mr. Chairman.
Thank you, Marcus. I'll bring in Mark.
Thank you very much. And Marcus has said much of what I was going to cover, so I shall focus on just one part, which is about the DSG overspend, which is, I think we use the word unmanageable in the report, and it clearly is accelerating. And what we are politicians. I think we're allowed to be political. I mean, what really got my goat, to be perfectly honest, was Tom Collins, MP, when he came in September. So talking about this time period when we're looking at the report for, saying that he'd come to hold Worcestershire to account for their failures in the provision of children for children with SEND and their families. Now, he said, I invite them to work with myself. Well, absolutely. Listen here, Tom. It's a £43 million overspend this year. It's accelerated from 23 the year before. Put your money where your mouth is. Let's have the cash. Let's see the real improvement in funding to support this level of demand. You're stoking and supporting demand here. Well, put your money where your mouth is. Let's see it in our financial settlement that's coming out at the end of December, because this is unsustainable and will destroy local government in not just Worcestershire, but across the country. So this new government has said it's going, fixing the system is one of their highest priorities. Let's have real growth in the cash that will enable the system to be properly funded, because otherwise we are all heading into really choppy waters. And if that override was just finished, this council and almost all upper tier councils in the country would immediately go into Section 114 notice, and everything would stop. So, you know, that's the real help MPs can be. I'm pressing this government to give the cash that is needed to support the service.
I'd absolutely echo that point, and I would say that, you know, our staff and our partners, as we've said this morning, work really hard in very difficult and vulnerable situations, and particularly for some people who need additional support in terms of SEND. We are trying our best to address those, but it's in a framework that feels unmanageable and unaffordable, actually, unless the government is going to put substantial resources in. And it is an existential threat to organisations like Worcestershire, but many of other county councils and unitary authorities across the country. We're heading for, effectively, across the UK, something like a £5 billion problem. Now, that's an astonishing amount of money. Ultimately, either the rules have to change or there has to be recognition that they have to be funded, because this isn't a sustainable position going forward. And it isn't as if it's just sat off balance sheet, not costing us any money. I alluded to the fact that servicing that deficit, if it reaches £80+ million, in terms of that, will be costing millions of pounds of taxpayers' money in Worcestershire to service that resource. So it does need addressing. We can't kick the can further down the road. It isn't something we can do ourselves in terms of addressing that, because we recognise that we need to consistently improve the services we do. That's the legislation. But ultimately, that legislation will need to change, or custom practice need to change, or it'll have to be funded centrally. There's no question about that. And that is the role, as I see it, for MPs, to bat for Worcestershire in terms of we are discharging a national duty, a national burdens put upon us to do, and therefore that it needs to be adequately funded. But I'll bring in a range of other speakers that we've inspired and sparked off, so I'll start with Emma and then Karen.
Yeah, thank you. I mean, it was particularly interesting to hear those two brilliant reports come through. The amount of work that this county council actually does achieve through partnership working, it's all brilliant information and useful statistics. And on that, when I speak to residents in my area, we're all understanding that a lot of our money goes on adult and children's social care, as it should do. We accept that. Again, a lot of my residents understand that there's costs coming forward on the national insurance and the pay increase and the minimum wage. Again, you know, we all understand that. What my residents are actually having a problem with are the fact that we're achieving 38 million or nearly 38 million pounds worth of savings this year, and that hasn't accounted for the extra costs coming forward from our service providers next year. Now, my residents and the electorate are not stupid. We know what's going on, and I will ask Rachel Reeves to say, does she understand what deprivation is? What is her new metric and how is she going to work it? Because she must include the provision for rurality. Rurality is an area which is overlooked when it comes to the socialist propaganda that she's putting out, that it's all in the towns. It's not. Rurality is a significant factor, and we do need it to be addressed. So I am very concerned with how the 700 million is coming forward and whether that comes through in a fair package. Thank you.
You're absolutely right, Emma, and I'd echo those points, but I'd also say it's about the services we provide, and we're delivering on behalf of the nation these very vulnerable services investment, and they have to be recognised in terms of the costs wherever they fall. And we can demonstrate where we're spending that money and absolutely be audited and held to account like we've been spoken about this morning. But ultimately, if so many institutions of all sorts of political colours at local level are facing these pressures, then they're beyond doubt, really, beyond reasonable doubt, as I would say, that these pressures need to be addressed. Karen.
Thank you very much indeed. I'd like to start by thanking every officer in the building that's had to work so very hard to get us into the current position with our budget. This has taken an extensive piece of work, and I've had the privilege of representing the Clent Hills on this Worcestershire County Council for a number of years now, but it's never been as difficult as it is today. So a massive thank you to all of them and the work that's gone in. My point builds on what Emma was saying actually about masking deprivation. We've been really good at self-funding as a county, I would say, particularly in adult social care. The increase in national insurance costs will lower the amount of time that residents have to pay for their own care. And why I'm saying that is, you know, my father's currently having a shower at home, and it's £30 for 20 minutes to come in. Those costs are going to go very significantly in the new year as a result of the national insurance, which will limit the opportunity for people to be self-funders, to look after themselves, and that bill then ends up with the county council. So I think we're putting people in a very precarious position at a time in life. We've got very proud people who receive adult social care, and many of our adults don't request the care. They'd rather have better health in old age, and there's a clear distinction. And it's a difficult one, but the masking of deprivation and the fact that they're talking about deprivation being the factor that determines how much money is allocated is a major concern. Because we know that deprivation in Worcestershire on the paper isn't severe, but in reality there are pockets of deprivation throughout our shire. And one size doesn't fit all, and if we're going to address, and this government's spoken very much about the wider determinants of health, health deprivation is up there. So if it's one person or 20, that needs addressing, but our overall demands on this council will continue to grow unless this government wakes up and sees the implications of the national insurance increase is just one element. I have a company in my county that employs 15 people. Their increase in the national insurance bill is £22,000. Thank you, Chairman.
And your point, Karen, was so well made that, of course, in this county we have a lot of self-funders. So we only deal with a very small minority of people who actually come forward to have to, who qualify for adult social care. But of course, if people's costs go up and they burn through their capital and the money they've put aside over a whole working life of hard work quicker, and with longer life expectancy, we could have the perfect storm there that counties like Worcestershire with an ageing population and in some cases, as I said, the working age disability and whole life disability, that's a particular concern, I think, if you accelerate that burn rate, that actually more people will come into our care and have to be funded by the local authority. And we've got a statutory duty at certain points to intervene and provide that. It's not an optional extra. We don't choose whether we provide a package of care, and that's right and proper. But that could have a substantial impact in terms of our cost, and one I don't think that's really recognised. The cumulative impact really of these measures I don't think are fully thought through, and we'll only see as the months and potentially years roll by the impact that will have for communities like Worcestershire. Colleagues, if there are no other further points, can we note the report as it's been moved and seconded this morning, and hope that people having to make those substantial decisions for Britain recognise the impacts on communities like Worcestershire. All in favour? Okay. We'll move next to the Treasury Management, and this is another mid-year, half-year position from up to the 30th of September 2024. We do regularly now talk about Treasury Management and how we deal with investments, our borrowing, and the prudential limits and the framework we have around that. It's important because actually it's dealing with vast sums of public expenditure. The good news is actually, and I'd want to put on record my thanks to the Treasury Management team, people working in finance, because actually it's very well managed in terms of that. We're increasingly and have increasingly used internal borrowing to try and manage the cost that we've had in terms of additional interest rates and the cost of borrowing, which had obviously gone up substantially, and managing the resources we've got rather than taking out long-term loans to try and keep that long-term cost to Worcestershire taxpayers as low as possible. We have also managed the investments we're making very prudently and sensibly, obviously being cognizant of risk. So first and foremost is always making sure you get the principal sum back and that we protect the investments that we make. Investment returns are a secondary nature and priority within our policies, and that's very sensible. And that has meant that we haven't been affected by some of those issues that other councils have. We haven't borrowed speculatively for buying shopping centres and doing all sorts of investments which are precarious or inject a level of risk. And again, in terms of our investments, we're very sensible and prudent about where we do choose to invest. What I would draw out of the report is the economic position. And this is one that I'm sorry to be negative, but we are seeing, as we've seen in recent days, an uptick in inflation. And I can only dread some of the impacts that I think that some of the national insurance issues that we talked about and the cost for businesses are going to see. The cost of employing people are going up, the cost for business are going up. I think that's going to have a secondary impact on inflation in the UK, and I think that inflation is going to wash through and potentially slow down economic growth, precisely the opposite to what the government says it wants to achieve. Lower economic growth is bad for everybody. It's bad in terms of generating wealth for the UK. It's going to impact in terms of the potential borrowing the government has to do, but also the amount of resources it has through taxation to deploy to the vulnerable services and society that we want to see, and for the Worcestershire we want to create. Because as Marcus drew out, it's not just about looking after the vulnerable. Absolutely, we need to do that. But it's creating that Worcestershire we want to see in terms of a healthy, happy, financially prosperous, better infrastructure, better economy, more environmentally friendly Worcestershire. And those long-term investments can only be afforded if actually we've got that discretionary expenditure to put to some of those issues. And so I do worry about some of those factors that are now in play in terms of, I think things were heading the right direction, but I think that interest rates are not going to fall as fast or as quick as they were, and that will impact in terms of companies and individuals and in terms of our own borrowing costs. I think inflation is going to be more sticky, and potentially that uptick that we're seeing might continue. And I think when I go out and speak to businesses, and we had a really good engagement with a series of businesses organised by the Chamber and our local enterprise partnership, people are hesitant to invest at the moment. They're looking at that and saying, is that the right thing? Can we afford to invest? Can we make that choice? And if lots of people do that, if lots of people hold back on long-term expenditure, on those more expensive purchases, or businesses fail to invest, the cumulative impact for Britain and the local impact we're going to feel in terms of Worcestershire could be quite profound. So I am feeling concerned about the context. And I mention that under Treasury Management because absolutely we need to look at that economic context when we're making decisions. So I'll move the recommendations as I set out 1A and B, and I'll look to Marcus just a second, and I'll open up the debate.
Yeah, thank you very much indeed, Leader. Happy to formally second the recommendations on page 47, 1A and B. Note the contents of the report, and obviously operating within our approved Treasury management strategy, and endorse the conclusions of the Treasury management activities, and that they continue to be cost effective, and a really helpful report. And actually, given the money that we hold and the manner in which we invest it and use our internal funding and internal borrowing and where it is really important, and it's right that we have the most robust of governance processes in place, and obviously thank the professional officers and indeed the team that deal with this, and of course also the good work of the Audit and Governance Committee as well in this area. But I don't think I've got anything else substantive to add, Leader, and endorse what you've said.
Thank you, Marcus. I'll open up the debate. David.
Thanks, Leader. Yes, I endorse all that you said. First of all, can I just also agree and thank the Treasury Management team for the excellent work they do in looking after our investments and ensuring that we get the best possible return on those as well. I echo what you say. I do think, excuse me, that once the markets have had time to consider fully the impact of the budget announced by the Chancellor, recently, you could see how the yield rates on gilts went to an all-time high, which obviously is going to increase government borrowing. I do believe that the Bank of England and the MPC are going to struggle to justify reducing interest rates in the view of rising inflation. And of course, rising inflation will be caused by an increase in demand based on the fact that our public sector have had significant pay increases way above inflation. And that will, I'm quite sure, will filter down through the supply and demand markets. And I do think that we're in for a rocky road. And I worry for how that will have an impact on this council in terms of how we have to manage our money and how it will affect the spending review that the government's going to have to look at in January. Thank you, Leader.
Particularly troubling time, isn't it, when you look at that, because actually the private sector has to have the confidence to invest and create jobs and sustain economic growth to be able to power that virtuous circle of growing the economy and providing more tax returns that obviously we can then deploy in terms of supporting our most vital services, and once that goes into a doom loop, then it could be very affected. So some pretty profound changes going on which we'll have to observe and monitor and respond to for the people of Worcestershire. Mark, I didn't know whether you wanted to make any contribution and any other colleagues, otherwise we'll bring this to a close.
I was reflecting yesterday just on a range of poor economic data that has come out really in the last few months, and you know, I would say this, wouldn't I? But I believe the economy had turned a corner earlier on in the year, and decisions made by the new government have certainly had an impact on inflation, as we will see, with significantly above inflation increases being handed out in a number of areas in the public sector, which has an impact in the private sector too, as they benchmark against one against the other. And you will see, and of course, we will see the inflationary impact of the budget with the national insurance and the minimum wage rises, both of which, you know, add to the pressures of small businesses with small margins. Their only ability it will be to put up prices and to hope that keeps them in business, but it will stoke inflation. What we've seen is unemployment unexpectedly tick up over the last 3 months. We've seen a revision down in growth. I mean, this government came to power saying growth, growth, growth were their, you know, three main priorities. And what the budget has done and what the OBR says is that growth is been revised down. And today we see the borrowing figures being the highest single month or single October almost since records began. You know, we are seeing all of those things which are not helpful in terms of the economic backdrop that this council is seeking to compete in. Now, what it will mean, as somebody else said, was that you know, interest rates will not fall as fast as they would otherwise. And there was a slight silver lining for us talking about Treasury management, is that we'll probably get slightly higher interest rates than we would have done. But then they'll be more than offset, I suspect, by the inflationary pressures that we face on the things we buy. If we were just loaning money to the market, it'd be a good news story. But as we're such a significant purchaser in the market, inflationary pressures and cost pressures are going to be outdone. So yeah, I don't, you know, unfortunately, and I mean this, you know, the UK, I want the UK economy to grow, irrespective of who's in power nationally. We want a growing economy. It's the only way we can get better living standards in the country. But unfortunately, so many of the things that have happened in over recent months, and particularly in the budget, are pointing in the wrong direction.
Absolutely, and of course, servicing our cost of borrowing whilst we're getting extra in terms of a higher interest rate, the cost of borrowing, it's particularly if we have to crystallise out that borrowing for the longer term, which we've been really resisting wherever possible, hoping that rates and seeing the progress that rates were falling. Actually, if that decline is slowed or arrested, that's a big issue. It's a big issue for people in Worcestershire serving mortgages as well. You know, a lot of people on 2 or 5 year fixes, they were rather hoping not to have recrystallised out that debt at a higher rate. A lot of those sub 4% mortgages are disappearing. Providers are not coming. So we're seeing an uptick in there. And even a titchy little small bit on a very large mortgage, which people are having to service, can have a big impact in terms of people who are just about managing. So I hate to sort of end today's session on that blanket of doom and gloom, but ultimately they are the things that we have to deal with in the real world here in Worcestershire. So moved, and it's been seconded. Can we just note this particular report with the comments we've had? And thank you everyone this morning. We have had a longer session, but by gum we've tackled some really important topics. So enjoy the rest of your day.